Welcome to the deep dive. Today, we're plunging into, well, the truly strange case of Dioctophyme Renale. You might know it as the giant kidney worm.
Yeah, and a worm in a kidney might not sound, super thrilling at first glance.
Right, but honestly, the sheer scale of this creature is just, well, it's just the beginning. It gets much stranger.
That's absolutely right. We've dug into some pretty remarkable sources, detailed biological descriptions, info on where this parasite actually shows up, and crucially, what it does to its hosts.
Mm-hmm.
And our goal today is really to unpack the most vital and, frankly, quite astonishing aspects of D. Renale.
So we want to give you a clear but also captivating understanding of this really remarkable organism.
Exactly.
Okay, let's get into it then. The very first thing that just leaps out from the material is the colossal difference in size between the male and female worms.
Absolutely, it's dramatic.
The females can apparently stretch up to a meter long, a meter, and over a centimeter wide?
That's right. And the males, they're almost petite in comparison, maybe 20 to 40 centimeters long and only about 6 millimeters wide.
You just have to wonder what's driving that massive disparity. Is it purely about maximizing egg production?
That's likely a huge part of it, yeah.
Mm.
But there could be other evolutionary pressures, too, leading to such a difference.
Just imagine something that long coiled up inside an animal. It's quite a thought.
It really is. And their appearance is also quite something. When they're alive, they have this vivid blood red color.
Blood red? Why?
It's thanks to a pigment similar to our hemoglobin called erythrochroin. But after they die, this fades to a kind of brownish black.
Huh, okay. And the eggs, are they just as weird?
They're distinctive, yeah. Sort of lemon-shaped with this pitted surface, except right at the ends. And they're usually a light tan or rust color.
Right.
But what's really fascinating is the sheer number of offspring.
Yeah.
One female can produce somewhere in the region of 18 to 20 million eggs in her lifetime.
Wait, 18 to 20 million from one worm?
Yep. Astonishing reproductive potential.
Wow. And I gather these eggs are pretty tough, too.
They are. They can apparently survive for up to 5 years in the environment, which is a long time.
That's incredible. But they do have weaknesses.
Oh, yes, thankfully. They're quite vulnerable to drying out, desiccation, and also freezing temperatures. So they're not invincible.
Okay, so you've got these millions of tough eggs. Now, for this incredible reproductive feat to actually happen, there's a crucial step missing, right? There's another player involved.
Correct. An absolutely essential intermediate host. It's a type of free-living annelid, Lumbriculus variegatus.
Which is more commonly known as?
Blackworms or mudworms, little segmented worms.
Now, where do you find these?
They're found in shallow freshwater habitats, pretty much globally, Europe, North and South America. They tend to feed on decaying organic matter at the bottom.
So these specific little worms are the only way the parasite can develop further.
Exactly. This is the only required intermediate host for the parasite to reach its next larval stage. It's obligatory.
Got it. So the cycle starts with these microscopic eggs getting into the water, maybe from an infected animal's urine, and then these blackworms eat them. And then, I suppose, any mammal that drinks that water and accidentally swallows an infected blackworm.
That's the primary route, yes. They're potentially in for a very unwelcome guest.
Okay. And that connection to water and these worms, that must explain where we tend to find this parasite geographically.
Precisely. We see it globally, mainly in temperate climates. But in North America, there are definite hot spots, like around the Mississippi River, Louisiana, Minnesota, Wisconsin, Michigan.
The Great Lakes region, basically.
Yes, and also in central and eastern Canadian provinces.
Yeah.
It's all linked to freshwater habitats where the blackworms thrive and where potential hosts might drink or feed.
And speaking of hosts, it's not just one animal, is it? The sources list quite a range.
Oh, wide range. Dogs are common hosts. Mink are actually considered the principal host in North America.
Mink.
Yeah. But also coyotes, jackals, raccoons, foxes, wolves, martens, otters, weasels, mostly fish-eating or semi-aquatic mammals.
Right, that makes sense with the water connection. And humans can get it too.
Yes, humans can be accidental hosts. We're not the intended target. But infection can definitely happen if someone ingests the infected intermediate host or another type of host.
Another type, like what?
Well, fish and frogs can act as what we call paratenic hosts.
Paratenic, what does that mean exactly?
Think of it like a transport host, or maybe a temporary waiting room. The parasite larva can survive inside the fish or frog, but it doesn't develop further.
Okay. So the black worm is where it has to develop, but a fish is just like a layover.
Exactly. The larva just hangs out there until a suitable mammal, like a dog or maybe even a person eating raw fish, comes along and eats the fish or frog. Then the cycle can continue in the mammal.
Gotcha. So that reinforces the link to water and animals that eat things from the water.
Precisely.
All right. So we have this enormous worm, millions of eggs, the essential black worm, various mammal hosts, and these transport hosts. Now, the life cycle itself. This is where it gets really interesting, I thought.
It's quite intricate.
Yeah, apparently for successful reproduction, you need both a male and a female worm.
Oh?
Okay, that makes sense. But they have to be in the same kidney.
Correct. Both need to be present in the same kidney.
And not only that, but the urinary tract, the ureter and bladder, has to be clear, unobstructed.
That's another critical point, yes. Otherwise, the eggs can't get out.
Talk about needing all the stars to align for the parasite. It's quite specific.
It is very specific. So, assuming fertilization happens, the fertile eggs are passed out in the host's urine.
Right.
Then they need to embryonate in water. This development stage can take anywhere from 1 to, well, maybe even 7 months.
Wow, that long.
It really depends heavily on the water temperature. The optimum range is around 25 to 30 degrees Celsius, so warmer water speeds it up.
And hatching only happens
Only if the embryonated egg is ingested by the right intermediate host, that Lumbriculus variegatus blackworm.
Okay. And once inside the blackworm, it's not immediately infectious, is it? There's another waiting period.
Indeed.
Yeah.
There's a significant development time needed within the intermediate host. It takes at least 100 days, sometimes longer, inside the blackworm for the parasite to molt and develop into the infective third larval stage, the L3 stage.
100 days. So over 3 months inside that tiny worm.
Yep. Only then is it capable of infecting the final definitive host.
And that infection happens when the final host eats the infected blackworm, maybe in contaminated water.
Or, as we mentioned, by eating raw fish or frogs that contain those L3 larvae they picked up from eating blackworms.
Right, the paratinic route. Okay, so let's say a dog eats an infected fish. What happens next? Does the larva just sort of teleport to the kidney?
No, not quite. There's quite a journey involved. The larvae first have to penetrate the wall of the stomach or the intestine. They then move into the submucosa, which is the layer just beneath the inner lining. After about, say, 5 to 7 days post-ingestion, they start migrating towards the liver.
The liver, not the kidney yet.
Not yet. They actually reside in the liver tissue for a considerable time, roughly 50 days or so.
50 days in the liver. Wow. Okay, then what?
Finally, after that period in the liver, they make their move towards the renal pelvis of a kidney.
And the source material mentioned a distinct preference for the right kidney. That seems oddly specific.
It does, doesn't it? The prevailing theory attributes this to simple anatomy. The right kidney is typically located closer to the duodenum, the first part of the small intestine where the larva might exit.
So it's just easier to get to.
That seems to be the main idea, yeah. Easier access during that migration from the digestive tract and liver. Some researchers also suggest the initial point of entry into the stomach might play a role too. Well, there's some thought that penetration near the stomach's greater curvature might correlate more with left kidney invasion, while larvae penetrating near the lesser curvature might end up causing liver cysts before potentially moving on. It's still a bit debated.
Fascinating. So it's a surprisingly precise, if still somewhat mysterious, migration path.
Very much so. And while the right kidney is the most common target, they certainly can end up in the left kidney.
Or elsewhere entirely.
Yes, occasionally they're found in more unusual locations like migrating down into the urinary bladder or getting lodged in a ureter.
And didn't one source mention a huge number found in one animal?
Ah, yes. There's an astounding record, I think it was in a dog, of 34 adult worms found.
34. In one animal. Good grief.
34. It really paints a picture of the potential burden these parasites can represent for the host.
No kidding. So after this incredible internal voyage, gut wall, liver, finally kidney, how long does it take for them to mature and start producing those millions of eggs?
Once they reach the kidney, the time from that initial ingestion of the infective larva to the worm reaching sexual maturity is about 3.5 to 6 months.
Okay.
So the whole life cycle, from an egg being shed to a mature adult shedding eggs again, takes roughly 2 years in total.
2 years. That is a long game for a parasite.
It's a considerable investment, yes.
Right. Now, let's shift gears slightly and talk about the impact. What do these giant worms actually do to their hosts. They're not exactly tiny when they finally arrive in the kidney.
No, they're already quite substantial. How they actually get into the renal pelvis isn't fully understood, but the leading idea involves enzymes.
Enzymes, like digestive enzymes.
Sort of. Things like collagenases, hyaluronidases, cysteine proteases. Think of them as biological tools, chisels, and dissolvers that the worm likely releases to help it navigate through and create space within the kidney tissue.
Interesting. Because an older idea was that they just sort of ate the kidney tissue.
Exactly. That theory seems to be largely debunked. Researchers haven't found solid food particles in their digestive systems. It seems less about eating the tissue directly.
And more about breaking it down to move through it.
Possibly, yes. Or perhaps more significantly, the damage comes from their sheer size and presence after they arrive.
Okay, so what's the main mechanism of harm then, if not just munching away?
It appears to be primarily obstruction. As these worms grow, sometimes filling the entire renal pelvis, their physical presence blocks the normal flow of urine out of the kidney.
Right, like damming a river.
Precisely. And this blockage leads to a condition called hydronephrosis, basically. The kidney swells up with trapped urine.
Which can't be good.
Definitely not. Or, if infection gets involved, it can lead to pyenephrosis, which is a buildup of pus within the kidney. Both are incredibly damaging.
And what does this look like at a microscopic level?
Looking at the tissue, you see widespread destruction of the kidney tubules, the small tubes that process urine, and a lot of inflammation. Interestingly, though, the glomeruli, the main filtering units, often seem relatively preserved, at least initially.
And eggs can get stuck in the tissue too.
Yes, eggs can sometimes be found embedded within the renal tissue itself. And the urothelium, the lining of the renal pelvis, often becomes hyperplastic, meaning thickened and overgrown, or even ulcerated due to the irritation.
It sounds pretty devastating for the affected kidney. But what about the animal overall? If it's just one kidney, can the other one cope?
Often, yes. If only one kidney is infected and the other one is healthy, the host can compensate remarkably well. The remaining healthy kidney can actually undergo hypertrophy, get bigger, and increase its functional capacity to pick up the slack.
So the animal might seem perfectly fine.
It might, especially early on. However, if both kidneys are parasitized, or if the animal already has some underlying kidney disease in the good kidney,
Then you're in trouble.
that's when you can see serious problems, varying degrees of renal failure, leading to uremia, which is that toxic buildup of waste products in the blood.
And the eggs themselves can cause issues even if they make it out of the kidney.
They can. As they travel down the ureters and into the bladder, they can cause inflammation along the urinary tract.
Okay. Now, the reading also mentioned some interesting findings outside the kidneys. Sometimes worms are found just loose in the abdominal cavity.
Yes, that's not uncommon, especially finding female worms in the peritoneal cavity, sometimes during unrelated surgeries.
Yeah.
They might be found, say, between the lobes of the liver.
How did they get there? Did they miss the kidney?
That's one possibility, or perhaps they reside there for a period before actually penetrating a kidney. It's not entirely clear.
And do they cause problems just floating around in there?
They can, yes. Particularly the eggs, if a female releases them into the peritoneum, they can trigger a significant chronic inflammatory response.
What does that look like?
You can get hemorrhage, bleeding, the formation of granulomas, which are balls of inflammatory cells trying to wall off the eggs, and fibrosis, or scarring. This can affect organs like the omentum, which is a fatty curtain in the abdomen, and the surface of the liver.
And there was something about female worms causing more inflammation there.
Yes, interestingly, it seems that female worms, presumably because they release eggs, tend to provoke a stronger inflammatory reaction in the peritoneum compared to just male worms being present.
And this inflammation can lead to fluid buildup.
It can. Ascites, which is fluid accumulation in the abdominal cavity, can occur. Sometimes this fluid is hemorrhagic, meaning bloody. The reported volumes can vary quite dramatically, from just a little bit to several liters in a dog.
Wow. So even if they don't hit the kidney right away, they can still cause significant trouble. Okay, let's talk clinical signs. What might make a vet or even a pet owner suspect this worm?
Well, often, as we said, there might be no obvious signs, especially if it's just one healthy kidney affected. It can be quite insidious.
But sometimes there are clues.
Yes. Vomiting has been noted in some dogs, shortly after they might have ingested infected blackworms, perhaps due to the initial gut penetration.
Okay.
Probably one of the first subtle clues, though, might be silent hematuria blood in the urine that you might not even see without a test strip or a microscope.
So invisible blood in the pee.
Exactly. In some cases, a vet might be able to palpate, to feel, an enlarged or maybe misshapen kidney during an abdominal examination.
Right.
And then, of course, if both kidneys are involved or if there's pre-existing kidney disease, you might start seeing the classic signs of renal failure, increased thirst, urination, weight loss, lethargy, poor appetite.
But that might mean it's quite advanced.
It could, yes. Severe bilateral infection can unfortunately progress rapidly and even be fatal. The overall severity really depends on a few things. How many worms are there? How long has the infection been going on? One kidney or two? And any other underlying kidney problems.
Okay. So if a vet suspects it, how do they actually diagnose it?
The gold standard, the most definitive way, assuming the urinary tract is patent, meaning open, is finding those characteristic D-Renale eggs during a microscopic examination of the urine sediment. Seeing the eggs confirms it.
But what if the worm isn't mature yet or the tract is blocked?
Right. Even if you don't see eggs, other findings in the urinalysis can be strong indicators. Things like hematuria, blood, pyuria, pus cells, and proteinuria, excess protein, all point towards significant inflammation or damage in the urinary system that can be caused by the worm.
And blood tests.
Blood tests might show signs consistent with chronic renal failure if there's significant kidney damage, like elevated kidney values, anemia, that sort of thing.
And imaging must be pretty important, too.
Hugely important. Plain X-rays might just show an enlarged kidney silhouette, maybe some distortion.
Okay.
A more specialized X-ray technique called intravenous urography, or IVU, where they inject contrast dye into a vein. That can be revealing. It might show a lack of dye being excreted by the affected kidney, indicating it's not functioning properly or is obstructed.
Right, but ultrasound sounds particularly useful based on the sources.
Ultrasound is often very, very helpful. It can clearly show the hydronephrosis, the fluid buildup, and, excitingly, it can often directly visualize the worms themselves.
Really? You can see the worms on ultrasound?
Yes. They appear as these distinctive hypoechoic, meaning dark, looping structures within the dilated renal pelvis. They have a characteristic spaghetti appearance on longitudinal view and specific cross-sectional shapes, too.
Oh.
You might even see movement if you watch long enough. And ultrasound can also potentially detect worms that might be free in the peritoneal cavity as well.
And I suppose CT or MRI could also be used.
Absolutely. CT and MRI can provide even more detailed cross-sectional images and can be very good at showing the worms and the extent of damage, both in the kidney and potentially elsewhere in the abdomen.
Okay, so diagnosis is possible, though maybe tricky sometimes. Once it is diagnosed, what are the treatment options? It doesn't sound like antibiotics are going to cut it here.
No, unfortunately, effective drug treatments, anthelmintics, are largely non-existent for this specific parasite in animals. It's a real challenge.
So what can be done?
The standard treatment, really the mainstay, for an infection in a single kidney, assuming the other kidney is healthy and functioning well, is surgery.
To do what?
To remove the affected kidney entirely, a procedure called nephrectomy.
Just take the whole kidney out?
Yes. Since the other kidney can compensate, removing the parasitized one is often the best way to resolve the infection and prevent further complications from that source.
Okay. But what if both kidneys are infected? You can't just remove both.
No, exactly. In that much more difficult situation, if there's still believed to be some functional kidney tissue remaining in one or both kidneys, a different surgery called nephrotomy might be considered.
Nephrotomy.
That involves surgically opening the kidney, physically removing the worms, and then closing the kidney back up.
That sounds risky.
It is definitely riskier. And sadly, by the time a bilateral infection is diagnosed, there's often already irreversible kidney failure, making the prognosis poor regardless of surgery. But it's sometimes an option.
And if worms are found just floating in the abdomen during surgery?
Oh, those can certainly just be physically removed at that time. That's straightforward enough if you're already in there.
And you mentioned medication isn't really a thing, but there was one case.
Yeah, just a single documented case report in a human patient where the anti-parasitic drug ivermectin was reportedly used successfully to treat symptoms, I think it was lumbar pain, associated with D-Renale. But that's really an isolated anecdote.
So not a standard treatment by any means.
Not at all. Developing drugs that can effectively kill such large, physically robust parasites located within an organ like the kidney is pharmacologically very difficult.
Yeah, I can imagine. So it seems like treatment options are pretty limited, especially for severe cases, which makes prevention sound even more important. What can be done there?
Absolutely. Prevention is key. And it really comes down to managing exposure risks, particularly related to diet and water sources for pets.
Like not feeding raw fish.
Exactly. Dogs and cats, especially in regions where Renale is known to be endemic, should really not be fed raw freshwater fish or fish organs, the viscera. That's a major potential source of infection via paratenic hosts.
Okay.
And similarly, preventing pets from drinking out of lakes, ponds, or other shallow freshwater bodies where those intermediate host blackworms might live is also crucial. Providing clean drinking water is important.
So responsible pet ownership, basically.
Yeah.
Knowing the risks in your area.
That plays a huge role, yes.
Okay, so to kind of wrap up our deep dive into the giant kidney worm, we've really looked at a truly enormous parasite, haven't we? Females hitting 1 meter long is just mind-boggling.
It really is. And its life cycle is so intricate, depending entirely on that specific little blackworm as an intermediate host.
Right, and sometimes using fish and frogs as these temporary carriers, the paratenic hosts.
And then its remarkable ability to undertake that long migration to the kidneys, often targeting the right one specifically.
Where it can cause pretty significant damage, mostly by blocking urine flow and causing inflammation, although you mentioned a single healthy kidney can often compensate quite well.
For a while, yes. And diagnosis relies heavily on finding those unique eggs in the urine or using imaging like ultrasound to actually see the worms.
And treatment, sadly, is often limited to surgically removing the whole affected kidney, as effective drugs just aren't really available.
It's a really fascinating, somewhat unsettling example of parasite biology and its potential impact on animal health.
Definitely. And it really drives home how interconnected ecosystems are, doesn't it? Like something as seemingly small and insignificant as a little mudworm in a pond can be such a critical link in the life cycle of this giant parasite, causing serious problems in mammals miles away.
Exactly. And even though it might seem like a really obscure topic, understanding these kinds of biological complexities is, I think, crucial for animal health, obviously, but also just for appreciating the sheer intricacy of the natural world.
Absolutely. And maybe on that note, here's a final thought for you, the listener, to maybe chew on. We talked about this parasite's apparent preference for the right kidney and the anatomical reasons suggested for that. It makes you wonder what other, maybe subtle asymmetrical vulnerabilities might exist in the animal kingdom. Are there inherent biases in anatomy or physiology that other parasites or maybe even predators exploit?
That's a great question. How might those asymmetries be leveraged in the constant push and pull of the natural world?
Yeah, and thinking specifically about this worm, what further research could really pin down the exact enzymatic tools it uses to get into and damage the kidney? It just feels like a reminder that even in biology we think we understand, there are always more layers to peel back.
Always more questions to ask.
Definitely. Well, thanks for joining us on this deep dive.